Welcome to Academia Zambia. This is Medicine 2021, May. Question 1, 2, 3 falling under section A, multiple choice questions. The first question says, when doing urinalysis, a urine specimen that is not processed within 1 hour after collection may result in erroneous measurement of, so is it A, glucose, bacteria, specific gravity, or other white blood cells? Now what we need to know is that, when doing urinalysis, a urine specimen that is not processed within 1 hour after collection may result in erroneous measurement of glucose, which is what? A answer. So that is the answer. Now one may ask, why is bacteria, specific gravity, white blood cells wrong? So the other options are not directly affected by the time delay. So bacteria, can multiply over time. So this is more relevant to urine cultures than urinalysis. All right. Then when you look at specific gravity, this actually measures the concentration of urine and is not significantly affected by time delays. Then white blood cells, they degenerate over time, and this is less critical for urinalysis, which typically looks for the presence or absence of cells rather than the exact count. So definitely this is wrong, this is also wrong, and this is wrong. So the correct one is what? Glucose. Okay, question 2 says difficult in maturation is known as what? Is it A, dyspepsia, B, dysuria, then C, dysphagia, then D, dysphasia? So when you look at these particular terms and the nature of the question, you find that the answer is going to be dysuria, which is B. Okay, so this is the answer. Again, one here may ask, so what you just need to know are definitions. Okay, they are just definitions. So we all know that dysuria refers to painful or difficult urination. Often it is actually accompanied by a burning sensation. It can be caused by various factors such as urinary tract infections, kidney stones, or prostate issues, right? Then what about these other options? So the other options are unrelated to urination difficulties. That is what you must know there. So like A, which is dyspepsia, is actually, or rather it refers to indigestion or stomach discomfort. Okay, and then for C, which is dysphagia, refers to difficulty in swallowing. Okay, difficulty swallowing. And then dysphasia refers to difficulty speaking or understanding language. So you find that B, which is actually dysuria, definitely qualifies to be the answer there. Are we there? So that is what we mean by those particular terms. So definitely the other options are wrong. Question 3 says a patient is taking diuretics that cause sodium loss for kidney from the kidney. The fluid or electrolyte imbalance most likely to occur in this patient is, so is it A, hyperkalemia, okay, then B, hyponatremia, then C, hypocalcemia, then D, isotonic fluid loss? So therefore the answer is going to be B, which is called hyponatremia. Now when you look at the other options, okay, the other options, I'll start with the A, which is hyperkalemia, is unlikely and as diuretics typically increases potassium excretion, leading to hypokalemia, which is low potassium levels. So in other words, you just need to know the definitions or what these medical terms basically mean. So these medical terms actually, they mean the following. Number one, which is called hyperkalemia, is a medical condition where potassium levels in the blood are higher than normal, which is this one. And then when you look at hyponatremia, is a medical term or condition where this where the sodium levels in the blood, lower, or rather lower than normal. And then hypocalcemia is also a medical condition where the sodium, or rather where calcium per se, where calcium levels in the blood are lower than normal. Okay. And then hypokalemia, like I said earlier on, basically that is the term. So hypokalemia is also a medical condition where potassium levels in the blood are lower than normal. Now, coming back to the options, like we said, B is the answer. According to the question, a patient is taking diuretics that cause sodium loss from the kidney. So the fluid or electrolyte imbalance most likely to occur in this patient is what? So the answer is B, hyponatremia. So why are other options incorrect? Okay, why are other options incorrect? So what we need to bear in our minds is that diuretics that cause sodium loss from the kidneys can lead to hyponatremia. So a condition where the sodium levels in the blood are lower than normal. So this is because the kidneys are losing sodium ions, which can disrupt the imbalance, or rather balance, of fluids and electrolytes in the body. So option A is unlikely, as diuretics typically increases potassium excretion, leading to hypokalemia, which is low potassium levels. And then option C is not directly related to sodium loss caused by diuretics. And then option D, isotonic fluid loss, refers to the loss of fluids with the same concentration of solutes as blood, which is not the primary concern with diuretic induced sodium loss. So those are the explanations. Thank you so much for listening, and do not forget to follow us, like us, and share our page. Thank you so much. God bless you.